Proper patient screening will select those patients with the signs and symptoms of a cervical lateral soft disc protrusion. These patients typically experience arm pain, which is greater than neck pain. They may display sensory alterations, such as numbness or paresthesias. They may display muscular weakness, and they may also show decreased reflex activity in one or both arms.
So you can tell, especially when you work, you know immediately when you've done something you should not have done.
Because what, you get a shooting sensation or something? Or?
You get a real sharp pain in the neck, and then all of a sudden a little numbness in the arm immediately.
Uh-huh.
And normally about 8 hours later, you can't even move your neck.
Really?
Yeah, it's almost, I'm laying like this, I actually have to grab my hair to pull myself up.
Is that right?
Oh yeah.
Wow.
That goes away in 2 weeks, and like 3 months later, somehow it always seems to come back.
The procedure is performed under fluoroscopic control. The disc level is carefully identified. This procedure can be performed from C3 to C7. This patient has a herniation at C5-6. A trocar is inserted into the skin and down to the disc space. Next, a cannula is inserted over the trocar and down to the disc space. The patient is constantly monitored fluoroscopically in the lateral and AP views. The trocar is removed and the nucleotome is inserted into the disc. Small pieces of disc can be seen in the tubing set and in the filter trap. The procedure takes about 30 minutes, and the patient is in the hospital for about 2 to 3 hours. Most patients experience immediate relief of symptoms or gradually over several weeks.
Okay, and a Band-Aid?
All right, after the hamburger, huh?
What?
You ready for a hamburger?
You bet.
Okay, I may join you in that.
Greg, we just watched your surgery, and I thought it would be interesting for you to tell us a little bit about what kind of work you had been doing prior to surgery, and exactly what kind of pain or numbness you had at that time.
Yeah, well, what I used to do was hang drywall and metal stud framing, and that after about 2 years ago when I initially injured my neck, it just hanging the drywall itself would kind of put a pressure, I would assume, on my spine, of which where I couldn't even move my neck. And when I'd wake up in the morning, I'd have neck pain, shoulder pain, all the way down into my arm. And then my hand would go numb every now and again. And I mean, it was like when I woke up in the morning or right before bed, if I laid a certain way. And that's pretty much the kind of pain that I had.
And for how long were you treated prior to surgery?
Well, I went and did some therapy where they did some traction. And then we took a rest period for about 2 months. I took off, just trying to get rid of the pain, and that didn't help at all.
I see. And now your surgery was about 3.5 months ago. How soon after the surgery did you note improvement in your symptoms?
Oh, immediately.
Immediately?
Immediately. The pain in my arm, the numbness, I've never felt it again since the surgery.
So you woke up after surgery that way?
Yeah, waiting for my hamburger.
I see. I see. You were hungry, huh?
Yeah.
Okay. And you did some physical therapy after surgery for about a month?
For about a month and a half, I think I did.
I
I did a month of just rehab surgery, and then I did a little bit of swim therapy.
And then you returned to a new job, I understand. Can you tell us about what you're doing now?
Well, I'm a construction superintendent, which takes a little bit of the physical out of it. So it's a little lighter work, but I still do a little drywall every now and again. You just gotta moderate it.
I see.
You know,
Okay.
you learn. You know
And
better.
are you having any pain or numbness in your arm any longer?
No, not at all.
I see. Could you please demonstrate the mobility that you have in your neck? Just move your neck around for us. Do any of those motions cause you any discomfort?
No.
Okay.
Actually, it feels real well.
Greg, I wanted to thank you for coming.
Well, thank you.